Hello everyone. From the series of cancer, today I want to start on lung cancer. Since lung cancer affects both men and women, it's the most common cancer affecting Canadians. Based on Stat Canada in 2022, on average, every day, 82 Canadians will be diagnosed with lung cancer and 57 will die from it. Also, it's estimated that about 1 in 11 Canadian men will be diagnosed with lung cancer in their lifetime and 1 in 18 will die from it. For women, it will be 1 in 15 diagnosed with lung cancer and 1 in 20 will die from it. 5 years net survival rate after the diagnosis of lung cancer is around 16%. So the prognosis for lung cancer is not very good. There are a list of different risk factors for lung cancer, and as we all know, the most important risk factor is smoking. Smoking will increase the risk of lung cancer by 10 to 30-fold. Aging is also important. Lung cancer is usually seen after age 40 and 50. Genetic also play important role. This cancer might usually run in families. Also, the history of tuberculosis infection might be a risk factor for lung cancer. Environmental exposure, for example, second-hand smoke, when we live with smokers in the same place, air pollution, radon gas. This will be an environmental concern in lots of houses, specifically basements in Kingston. So radon gas, good to know, that might be a risk factor for lung cancer. Exposure to asbestos or heavy metals like chromium, arsenium through the workplaces or factories might be some risk factors for increasing the chance of lung cancer. Also, for any reason, for example, if a patient gets radiation for esophageal cancer to the chest area, this exposure to radiation also might be a risk factor for lung cancer. Regarding diet and different nutrients, there are not much research showing the association of different nutrients and the risk of lung cancer, as based on the updated research, consumption of red meat with the focus on having high intake of saturated fat might be a risk factor for lung cancer. And also, like all other types of cancer, vitamin D deficiency has been shown to be a risk factor for lung cancer. In the next video, I will talk about different types of lung cancer, staging, grading, and the prognosis.